Let's move on to the Barack Obama healthcare speech and our good friend Joe Wilson. So, what was the speech? This was the speech that Barack Obama gave to finally outline exactly what he wants in a healthcare plan. And this was on Wednesday. I thought it was a great speech in terms of as a speech. Now, did he actually explain what is he going to do and what is the plan? Well, I'm not sure. He's certainly said a bunch of stuff, and we'll see how much of it is has been fact checked. So this was in front of a joint session of Congress. Here's the main points of the speech, and here's what Barack Obama wants to do with healthcare, as I understand it, Lewis. And feel free to correct me if I'm wrong. And I'm sure that we will get emails from both sides of the political spectrum addressing whether or not my interpretation is a good interpretation. Barack Obama wants to provide health coverage to those without insurance and improve coverage for those who are already covered. That's clear. That's good. I like that. He wants to address the rising costs of healthcare with emphasis on the government-funded burden of Medicare and Medicaid. I think that that's great. We know about increasing costs. I can't imagine anybody who would say, you know what? I actually am fine with increasing costs. I'm fine with this super inflation of healthcare costs. Fine. Next, we want to instate laws, or he wants to instate laws that protect individuals from losing coverage due to pre-existing conditions, suffering annual and lifetime caps on claims, and going without preventative care. I absolutely agree with that. I think that there was a standing ovation at that point from both sides of Congress, and this was pretty political. This was much like the State of the Union, where you'll see people stand and sit based on really line by line what's being said. Moving on. Barack Obama wants to introduce a healthcare insurance exchange. To boost competition in the market. So when he mentioned this during this speech, he mentioned John McCain. The camera cut to him, and he did his, actually, this was kind of a funny moment. He did not only his awkward smile, but he did a thumb up as well. So this smelled to me very similar in some ways to the McCain idea of everyone buys their healthcare, your employer doesn't provide it anymore, and you get a tax credit, which I don't think is a good idea at all. Very few people thought it was a good idea when John McCain started pushing this during the debates in the run-up to the election. Barack Obama said that it wouldn't work that way, that this would just be, there would be incentive for the insurance companies to participate in this because it would open them up to tens of millions of people that don't have health insurance. These are potential new customers, so that it wouldn't be the type of thing where you just go out and everybody buys the insurance. It's not provided through their employer. Fine. I'm not too sure about that. He also said that the government should immediately provide need-based tax credits for those that have been denied coverage due to pre-existing conditions. That could be okay, depending on how it's set up. Again, a lot of John McCain's ideas were this whole tax credit thing. So I don't know how far into that Barack Obama really wants to go. Okay, now here's the biggest problem I had. Make basic coverage a requirement, meaning there would be a mandate for insurance. There would be a fine if you don't have insurance. Apparently for families earning around $65,000 a year, that fine could be $3,800. So this could be trouble. And Lewis, we broadcast our show in Massachusetts. Massachusetts and Governor Deval Patrick, who's been a guest on this show multiple times, has put in place basically this exact same thing, where you must have health insurance when we do our taxes every year. If we file in Massachusetts, we're asked to put in who's your insurance company, what's your plan, what's your group number, social security number, so on and so forth. And it has been a disaster in many cases. Many people, go ahead.
Well, so you have to look at this from, the bigger picture. I'm sure this is one of those measures that is supposed to, save money in the long run. Okay, so people, this forces people to get health insurance. They have the health insurance. They're more likely to go to the doctor if there's something wrong with them, and, it won't catch up with them later, and, they won't be hit with all these bills. The hospital won't be hit with these bills. That could add up. So I think this is just trying to prevent. I think this ultimately could save money.
Well, but the thing is, in Massachusetts, it has not worked. And why hasn't it worked? Because of the incredible costs of health insurance, there are people who have figured out it is cheaper for me to pay the fine for not having health insurance than to get health insurance. Now, at $3,800,
to assume nothing goes wrong with you,
and to assume that and take that risk. Now, hey, if you're wrong about that, it's still going to. It's still not going to, somebody's going to pay for it. You're absolutely right. And it should encourage preventative care. But in Massachusetts, I don't think that this has worked particularly well. And if people start taking the fine instead of buying health insurance, now I hear Barack Obama saying it'll be cheaper. It'll be cheaper, so that it's not going to be the case. People will be able to afford it. I don't know. Okay, he also wants to debunk the rumor of death panels, that there's insurance for illegal immigrants. More on that later. Government funding for abortion. Good luck getting over the Republican spin machine on that. He also wants to explain where funding for the new bill comes from, and this will be a combination of eliminating unnecessary costs, charging fees to private insurers on their highest price policies, so on and so forth. Many fact checkers have said it is not true that this plan would not add money to the deficit. I don't know, of course. Now, strategically, I think later on he mentioned there would be a public option ideally, and this would be if you have no insurance, if you have a pre-existing condition, if you simply can't afford it, even with a tax credit and even in this marketplace, there should be a public option. There should be a public option. A lot of people didn't like that. Let's listen to a couple of clips. Here he is talking about affordable insurance.
Now, if you're one of the tens of millions of Americans who don't currently have health insurance, the second part of this plan will finally offer you quality, affordable choices. If you...
Okay, so people like that, and then here he is talking about death panels are not, they're not real. It's just a figment of your imagination.
Some of people's concerns have grown out of bogus claims spread by those whose only agenda is to kill reform at any cost. The best example is the claim made not just by radio and cable talk show hosts, but by prominent politicians, that we plan to set up panels of bureaucrats with the power to kill off senior citizens. Now, such a charge would be laughable if it weren't so cynical and irresponsible.
Okay, here he is addressing the pre-existing condition issue.
Under this plan, it will be against the law for insurance companies to deny you coverage because of a pre-existing condition.
All right, everybody seems to like that. Everybody stood for that. And let's skip ahead to Barack Obama will not accept the status quo.
Know this. I will not waste time with those who have made the calculation that it's better politics to kill this plan than to improve it.
All right, so some agreement on that. And then here he is saying he will be the last president to have to deal with this.
I'm not the first president to take up this cause, but I am determined to be the last.
Okay, so pretty good speech, I thought, overall. Stayed on message, kind of combined both the nitty-gritty nuts and bolts of what he's proposing with kind of some stories. He told one story about Ted Kennedy. He talked about malpractice, so on and so forth. Now, the biggest news coming from this could have been this Joe Wilson incident. Now, there are two Joe Wilsons, and you might have been a little bit confused. If you remember Valerie Plame, the outing of CIA agent Valerie Plame, her husband, who is Joe C. Wilson, born in 1949, is a former U.S. ambassador. He is the guy who went to Nigeria and yellow cake uranium, so on and so forth. The Joe Wilson who caused this controversy with Barack Obama, and we'll talk about why in a second, is a different guy. His name's not really Joe. His real name's Addison Graves Wilson Jr., born in 1947, 2 years prior to former Ambassador Joe Wilson. And they call him Joe Wilson for some reason. And he was engaged in an incident where he yelled out to Barack Obama, "You lie," when Barack Obama said his plan will not cover illegal immigrants. And it was all downhill from there. Let's take a listen.
There are also those who claim that our reform efforts would ensure illegal immigrants. This, too, is false. The reforms I'm proposing would not apply to those who are here illegally.